Have you been feeling unusually thirsty lately? Or maybe you've noticed that small cuts and scrapes are taking much longer to heal. These aren't just minor annoyances. They could be your body's warning signals, and the biggest mistake, you're dismissing them as just getting older. Think back. There was a time when you knew something felt off, but you brushed it aside. Many seniors do the same with diabetes symptoms, but today, we're going to change that. In this video, I'll reveal 9 hidden signs of diabetes that most seniors miss until it's too late. These subtle symptoms often go unnoticed, but recognizing them early could literally save your life. Catching diabetes before complications develop gives you more treatment options and a better chance at staying healthy longer. Before we begin, hit that subscribe button and stay tuned until the end. Because some of these signs are so easy to miss, you may have overlooked them yourself. Once you recognize these warning signs, you'll have a clear idea of where you stand and what small changes could help you add years to your life. Now, let's get started. 1. Frequent hunger. Have you ever found yourself standing in front of the fridge hungry again, just hours after eating a full meal? You might think, maybe I just didn't eat enough, or maybe this is just part of getting older. But here's the surprising truth. That constant hunger could be an early warning sign of diabetes, especially if you're over 60. Your body runs on glucose. It's like fuel for your cells. But with diabetes, something crucial goes wrong. Your bloodstream is full of glucose, yet your cells can't access it. Imagine a car with a full gas tank, but a broken fuel line. The fuel is right there, but the engine can't use it. So what happens next? Your cells are essentially starving, even while your blood is flooded with energy, and your body, trying to fix this energy crisis, keeps sending hunger signals. Doctors call this polyphagia, or excessive hunger. But here's the problem. Many seniors mistake it for just another part of aging. My metabolism is slowing down, or my appetite is changing. That misunderstanding can delay diagnosis for years, allowing diabetes to progress unchecked. It's not just about feeling a little peckish before lunch. Imagine eating a full breakfast, eggs, toast, fruit, yet by mid-morning, your stomach is growling like you skipped a meal. Normal hunger comes and goes. But diabetic hunger? It lingers no matter how much you eat. Your body wants to use the glucose in your blood, but insulin, the key that unlocks your cells, isn't working properly. Since your cells stay locked, your body panics and tells you to eat more, even though food alone won't fix the issue. And here's something even more alarming. If you're eating more than usual but still losing weight, that's a red flag. Your body is breaking down muscle and fat to get energy because your cells are still starving. If you find yourself constantly hungry, even after eating full meals, don't ignore it. It's time to check in with your doctor and get your blood sugar tested. Catching diabetes early can make all the difference in managing it effectively. So if this sounds familiar, don't brush it off. Take action today. Your health is worth it. 2. Unexplained weight loss. Is the number on the weighing scale dropping without you even trying? At first, it might feel like a pleasant surprise. But what if I told you this could actually be a distress signal? But when your body starts shedding pounds without any effort on your part, it's rarely the metabolic miracle many seniors hope for. Instead, it's often a red flag, a sign that something isn't right with how your system processes energy. With diabetic weight loss, your cells are starving at the cellular level. Even though there's plenty of glucose in your bloodstream, your cells can't access it. Imagine being locked out of a house filled with food. You're surrounded by nourishment, but you can't get to it. So what does your body do? It goes into survival mode, breaking down fat reserves and even muscle tissue just to create the energy it needs. This creates one of diabetes' most troubling paradoxes. You might be eating more than ever, yet the pounds keep dropping. Your pants get looser, your shirts fit differently, despite finishing everything on your plate and even going back for seconds. Doctors consider weight loss significant if you lose 5% or more of your body weight in 12 months without even trying. To put that into perspective, if you weigh 180 pounds, losing just 9 pounds could be a warning sign that demands immediate attention, and after age 60, this becomes even more critical. Unexplained weight loss doesn't usually appear alone. When it's combined with other warning signs like increased thirst and frequent urination, it paints an even clearer picture of diabetes. Your body is trying to flush out excess sugar while simultaneously breaking down muscle and fat because it can't use that sugar properly. The thrill of effortless weight loss can be deceiving. Shedding a few pounds without dieting or exercising might seem positive, but in seniors, it's a symptom that should never be ignored. That seemingly good change could be masking a serious condition that needs prompt medical attention. If this sounds familiar, don't wait. Talk to your doctor and get your blood sugar checked. Catching diabetes early can make all the difference. 3. Frequent urination. Those nighttime trips to the bathroom that keep interrupting your sleep might not just be an inconvenient part of aging. If your kidneys are working overtime to filter excess sugar from your bloodstream, they could be trying to tell you something that many seniors completely overlook. When blood sugar levels rise too high, your kidneys jump into action. Think of them like an overworked water filter struggling to keep up with contaminated water. To flush out that excess sugar, your body needs a lot of water, which means you start producing more urine than normal. Before you know it, you're making extra trips to the bathroom, sometimes more than 8 times throughout the day and night. Needing to urinate more than 3 times during the night, a condition called nocturia, is a significant red flag. Many seniors assume these midnight bathroom trips are just part of aging bladder or prostate issues. But there's a key difference. Urinary incontinence involves losing bladder control, while polyuria means your body is producing abnormally large amounts of urine due to high blood sugar. This sets off a dehydration cycle that can be easy to miss. The more your body loses water, the thirstier you become, so you drink more and the cycle repeats. Many seniors never connect this pattern to diabetes, dismissing it as just another part of getting older. There's a simple way to determine if this is a cause for concern. Track your bathroom habits for a week. Pay attention to how often you're going, especially at night. If you notice an unusual pattern, bring this information to your doctor. Catching diabetes early can prevent complications and help you take control of your health before it's too late. And these nighttime patterns might not be the only warning signs, so let's take a closer look at what else your body might be telling you. 4. Darkened skin on the neck. Those dark velvety patches on your neck or underarms aren't just harmless skin discoloration, they're an urgent signal from your body about what's happening inside your bloodstream. Known as acanthosis nigricans, these markings are closely linked to insulin resistance and can indicate diabetes years before other symptoms appear. They're hard to miss with a distinctive dark brown or black color and a velvety texture that feels soft to the touch. Think of them like stubborn stains on a favorite shirt. No amount of washing makes them disappear, and regular skin treatments won't work either. These patches tend to develop in specific areas like the neck, armpits, groin, elbows, and knees. Beneath the surface, excess insulin is disrupting normal skin cell function, triggering abnormal growth and darkening. This is a direct sign that your body is struggling to regulate blood sugar properly. Acanthosis nigricans is one of the strongest visible indicators of diabetes, appearing in people with type 2 diabetes. What makes it especially concerning is that these skin changes often show up long before other symptoms, offering a crucial early warning that shouldn't be ignored. Depending on your skin tone, the patches may look more pronounced or subtle, making them easier to overlook. That's why regular self-checks are so important, especially as you age. Taking just a few moments each month to examine these areas could make all the difference. If you notice these patches, take photos every few weeks to track changes over time. This simple step helps your doctor assess whether further testing for diabetes or insulin resistance is needed. Catching these warning signs early gives you the chance to take action before more serious complications arise. 5. Vision changes. Imagine a world where your vision sharpens and blurs unpredictably throughout the day. Your eyes might be sending crucial early warnings about diabetes, yet many people overlook them. If you've noticed your eyesight becoming blurry, only to improve later, this puzzling fluctuation isn't just a sign of aging. It's your body's way of revealing unstable blood sugar levels. When blood sugar levels rise too high, something remarkable happens inside your eyes. The lens, which focuses light, begins to swell due to fluid imbalances. This swelling distorts its shape, causing temporary blurriness. Because this effect can come and go, many seniors dismiss it, assuming it's just a normal part of getting older rather than recognizing it as an urgent signal of developing diabetes. Eye doctors are often the first to detect undiagnosed diabetes. During routine exams, they can observe subtle changes in the retina's blood vessels that suggest elevated blood sugar levels. These signs often appear before any other noticeable symptoms. If you've needed frequent changes to your eyeglass prescription, it could indicate an underlying issue that needs immediate attention. Ignoring these early signals can lead to serious consequences. Diabetic retinopathy, a condition where high blood sugar damages the delicate blood vessels in the retina, is one of the leading causes of vision loss in adults. This damage progresses silently, often becoming irreversible by the time symptoms become severe. If you've experienced floating spots, difficulty focusing on nearby objects, or vision that fluctuates throughout the day, pay close attention. These patterns strongly suggest blood sugar fluctuations affecting your eye's lens. Spotting these changes early can be the key to preventing long-term damage and taking control of your health. Slow healing of cuts and wounds. Beyond blurry vision, another overlooked warning sign of diabetes hides in plain sight. A small cut that lingers for weeks, healing far more slowly than expected. While aging naturally slows wound healing, diabetes causes delays that go beyond typical age-related changes. Elevated blood sugar damages both blood vessels and nerves, compromising the body's ability to repair itself. With reduced circulation, essential nutrients and oxygen struggle to reach injury sites, leaving even minor wounds open far longer than normal. A paper cut that might heal in a few days for someone with balanced blood sugar could remain unhealed for 2 weeks or more in a person with diabetes. Maria, a 68-year-old, dismissed a small cut between her toes as insignificant. "I thought it was just age," she recalls. 3 weeks later, the wound deepened into a serious infection, putting her foot's health at risk. Her story highlights the danger of assuming slow-healing wounds are merely part of getting older. Certain signs can distinguish diabetic wounds from normal cuts. A wound remaining open beyond 2 weeks. Cuts growing larger instead of shrinking. Unusual discharge or odor around an injury. Foot injuries require particular attention. People with diabetes develop foot ulcers, and many diabetes-related amputations begin with a small wound that fails to heal properly. Recognizing these warning signs early can prevent serious complications. If a cut takes longer than usual to heal, take photos every few days. Note the date of each picture. Share this timeline with your healthcare provider. This simple documentation can help detect diabetes-related healing issues before they lead to severe infections or permanent damage. 7. Tingling, numbness, or pain in the hands or feet. That tingling sensation in your fingers and toes isn't just another quirk of aging. It could be your nervous system sounding an alarm about your blood sugar levels. This mysterious feeling, sometimes a burning sensation, sometimes numbness, is a hallmark of diabetic neuropathy, a type of nerve damage caused by prolonged high blood sugar. Diabetic neuropathy affects diabetes patients, often starting subtly before becoming more pronounced. Think of your nervous system as an electrical grid where sugar-damaged wires send faulty signals, leading to these unusual sensations. Many seniors mistakenly attribute them to arthritis, poor circulation, or normal aging, missing a critical early warning sign of diabetes. One key characteristic of diabetic neuropathy is its distinctive pattern. Unlike general age-related discomfort, it often appears asymmetrically, one foot tingling or burning more than the other. Another red flag? Symptoms worsening dramatically at night. These patterns set it apart from other conditions like poor circulation or joint issues. If left unchecked, occasional tingles can progress to persistent numbness, burning pain, and even permanent nerve damage. What starts as mild discomfort can turn into serious mobility issues over time. But here's the crucial part. These symptoms often appear before a diabetes diagnosis, making your nervous system an early alarm system for dangerous blood sugar fluctuations. Fortunately, healthcare providers can detect diabetic neuropathy in its earliest stages using simple, painless nerve function tests. These in-office assessments measure your nervous system's response, distinguishing between normal aging and diabetes-related nerve damage. Identifying the issue early can help prevent further complications and, in some cases, even reverse nerve damage with the right interventions. 8. Sexual dysfunction. Beyond those nerve tests that reveal problems in your extremities, there's another early warning sign of diabetes that rarely gets discussed, one that affects your most intimate moments. Those unexplained changes in your bedroom might actually be connected to your blood sugar levels in ways most people never suspect. Sexual dysfunction affects men and women with diabetes, yet this warning sign often goes unrecognized for years, with many seniors never making the connection to their overall health. The same process that damages nerves in your hands and feet extends to the delicate network of blood vessels and nerve pathways essential for sexual function. When blood sugar remains elevated, these systems deteriorate, affecting arousal, sensation, and satisfaction. Men frequently experience erectile dysfunction while women may notice decreased genital sensation or persistent dryness that standard remedies don't resolve. What makes these symptoms particularly valuable as warning signs is their timing. Sexual problems often appear years before other commonly recognized diabetes symptoms, giving you an early opportunity to investigate blood sugar issues before serious complications develop. Many seniors attribute these changes to normal aging, missing this crucial signal that something deeper might be happening. When these intimate challenges appear alongside other symptoms we've discussed throughout this video, increased thirst, frequent urination, or unexplained weight changes, they form a pattern that strongly suggests diabetes as a possible cause. The good news is that addressing diabetes often improves sexual function as blood sugar stabilizes, especially when caught early. Having an honest conversation with your healthcare provider is essential. While discussing sexual issues might feel uncomfortable, remember that doctors view these concerns as legitimate medical issues deserving of proper attention. Many healthcare providers are specifically trained to discuss these matters with compassion. This conversation could lead to early diabetes detection and effective treatments for both conditions. 9. Dry mouth. While honest conversations with your doctor about intimate issues can lead to early diabetes detection, another often overlooked warning sign might be sitting right on your nightstand. That water glass you refill constantly? It's revealing a medical mystery happening inside your body, one where drinking more water paradoxically leaves you feeling thirstier than before. This persistent thirst, medically known as polydipsia, creates a vicious cycle in your body. Imagine a desert landscape where each rainfall evaporates before it can nourish the ground. This mirrors what happens when diabetes causes your body to expel the very water you're desperately consuming. Your mouth feels perpetually dry like sandpaper, making even speaking difficult without taking regular sips. The science behind this symptom reveals a concerning process. When blood sugar rises too high, your kidneys work overtime to filter excess glucose, using significant amounts of water in the process. This literally drains moisture from your tissues while your salivary glands produce less saliva than normal. The result? A dry mouth that water temporarily relieves but never fully resolves. Many seniors mistakenly attribute this thirst to aging, medication side effects, or simply inadequate hydration. However, you cannot solve this problem by simply drinking more water. This creates a troubling pattern. Increased fluid intake leads to more bathroom trips, causing further dehydration and intensifying thirst. A practical way to identify this pattern is keeping a fluid intake journal for 7 days. Record how much you drink, when you drink it, and whether your thirst feels satisfied afterward. If you consistently consume 8 to 10 glasses daily yet still experience dry mouth and excessive thirst, share this information with your healthcare provider. Don't dismiss these symptoms as merely inconvenient. When persistent dry mouth appears alongside other warning signs we've discussed, it warrants immediate medical attention and blood sugar testing. Once diabetes is properly diagnosed and managed, this frustrating cycle of thirst often improves significantly. Now that we've uncovered these 9 warning signs, remember they're like pieces of a puzzle. They often appear together. When multiple symptoms emerge, your diabetes risk rises significantly. The good news: early detection makes an extraordinary difference, reducing complication risks through these simple changes. If you've recognized several warning signs, don't wait. Schedule a healthcare appointment this week. Key next steps include adopting a balanced diet, increasing physical activity, monitoring blood sugar levels. Your health journey matters. Share this video with someone who might be missing these crucial signals. Recognizing these warning signs today means a healthier, more vibrant tomorrow.